ready from my end, sir.
Thank you, Abhishek. नमस्कार, मेरा नाम है डॉक्टर आलोक रॉय। मैं मेडिका की तरफ से हर हफ्ते हर शनिवार को 5:30 से 6:30 आप लोगों के लिए स्वास्थ्य संबंधित जो भी चल रहा है उस समय या इस समय के लिए रेलिवेंट है लेके आता हूं, और हमें बड़ी खुशी है कि हम आपसे इस तरह से जुड़ सकते हैं। And we are trying to bring the latest in healthcare relevant to this session, this season to you. If you follow it, if you understand it, then you will do a favor to yourself and to us. You'll stay healthy. That's what we want. We are in the midst of third wave, as you all know, of COVID-19, and Omicron is running high and low. And fortunately, in Bengal, we are seeing that Omicron numbers are dropping. The number of infection rates are dropping, which is a good news. And that means that less people will fall sick. That means we'll have to take care of less people, which we always want. We want you to stay healthy and happy. I have with me today Dr. Arnab Bera. He's a critical care specialist and lung specialist. He's a young pulmonologist who has been with us for many years. He has treated thousands of patients with lung disease. So when I spoke to him about how do we take care of lungs in the winter, he has prepared a very nice presentation, very simple and to the point, and which you will find comfortable. I would like you to please ask as many questions as possible. You can ask on chat, या आप हमें जो है चैट पे भेज दें, या एक हमारा फोन नंबर है 7439600616 7439600616। ये नंबर आप अपने पास रख लें। आपको कभी भी कुछ भी जानना हो, स्वास्थ्य संबंधित कोई भी सहायता हमसे चाहिए हो, बेफिक्र होकर हमें फोन करिए, हम आपके फोन का जवाब जरूर देंगे। हम कोशिश करेंगे कि आप हमें अगर व्हाट्सएप पे भेजें तो ज़्यादा हमें सुविधा रहेगी, और हम आपको उचित आंसर जितनी जल्दी हो सके देने की कोशिश करेंगे। We'll try to come back to you if you write to us on WhatsApp. With this, I hand it over to Dr. Arnab Bera for today's evening session, Winter and Lungs. Arnab Bera, over to you.
Good evening, sir. Good evening, everybody. So today, sir has chosen a topic that is called winter and lungs. So everybody is aware that in winter season, so the lung problems are increased. Actually, basically the patients who have the asthma, COPD, okay, the breathing disorder. These patients actually suffer from worsening breathing problems, sometimes infections, pneumonia, these kind of things. Okay. So we'll go deep into it, why these lung problems mainly occur in increases during these winter seasons, and what are the precautions you can take to avoid this kind of thing. Abhishek, can you show me the slide, please? Abhishek?
Yes, he's showing it.
Okay. So next slide, please, Abhishek. Yeah. So actually, who are the most vulnerable persons in this cold weather? So you have to be aware of that. So mainly the elder people, more than 60, 65, and who has a long-term health conditions like, diabetes, hypertension, heart problem, kidney problem, on dialysis patient. So these are the main patients, actually vulnerable patients who suffer a lot from during this winter season. Babies and children under age of 5, you can see these patients many times suffer from common cold and cough. Even we also. And people who has a low income, who are from a low income setting, those who cannot afford heating, people with disability, pregnant women, and people who have a mental health condition who cannot take care of himself or herself properly during this winter season. Next slide, Abhishek. Okay. So, I have already told you this, the winter season is difficult for patients with chronic lung disease. So why this? Because the cold air during this winter, and not this cold air only, the dry air, the humidity of the air goes very dry during these times, which actually exacerbate these respiratory problems in asthma as well as the COPD patients. Next slide, Abhishek. Okay. So what is this impact of this cold weather? So cold air, often this dry air actually create problems in patients with this chronic lung disease. This dry air actually irritates the airway because it acts kind of as an allergen. Okay, so it irritates your airway, and that can lead to wheezing. Wheezing means some blowing sounds during from your whistling sound from your lungs during your breathing, coughing, and breathing problem. Okay. Next slide, Abhishek. Okay.
Arnab,
Sir.
go a little slow. Go
Okay,
back to the previous slide.
Okay, sir. Go back to previous. Okay.
So what Dr. Arnab Bera is saying कि cold weather में आपको तकलीफ इसलिए ज्यादा होती है क्योंकि हवा में पानी की नमी की बहुत कमी होती है. उससे क्या होता है कि आपके जो गले के जो रास्ते हैं उनमें बहुत इरिटेशन होता है. इसकी वजह से आपको कफ और सांस लेने में तकलीफ होती है. Yes,
Sir, yes, sir. And I also would like to hear something that this lung, this airway pipe. This is actually covered by a thinner layer of mucus. Okay, so this mucus layer actually protects our airway from the outside allergens, bacteria, viruses, this kind of thing. So what happened during this dry weather actually? In dry weather, this thickness of this mucus layer actually goes down. So its activity goes down, and people actually are more prone to having these lung problems like infections, pneumonia, and your breathing problem exacerbations during this winter season. Okay. Next slide, Abhishek. So, so I just here I'll also add some points here. Actually, most commonly what we see during this winter season is common cold and cough. Okay, so yeah, you will have a runny nose, you will have a sore throat, that is your pain in the throat, along with a cough. Sometimes it is dry, sometimes it is with expectoration. The expectoration may be normal, whitish in color. Sometimes it is purulent, that is yellowish in color, which indicates you have some infection. Okay, so mostly these infections actually from viral origin. Okay, mostly from viral origin. So you don't require any antibiotics for this common cold and flu. Okay, doctors regularly sometimes prescribe antihistaminics, that is an anti-allergic medications, which you have to take. Along with, you can take steam or gargle kind of thing. That is sufficient for this common cold and cough. You don't need any antibiotic for this. It will go by 5-7 days normally, naturally. Okay, but it is important when you're coughing, the sputum color becomes white, becomes yellow. That means your lung is getting infected with super added some bacterial infection. Though your sputum may be yellow, your sputum maybe have a bad smell. So in that time, you have to contact your doctor, and you must need some kind of antibiotics during that point of time only. Otherwise, for normal common cold and flu, you don't require any antibiotics regularly. Basically, mostly the children.
अर्नब, डॉक्टर अर्नब कह रहे हैं कि जाड़े में जब अगर आपको खांसी हो और बलगम निकल रहा हो तो आपको दो चीज का ध्यान रखना है. बलगम का रंग जो है वो बहुत ही क्रिटिकल है. कलर ऑफ योर एक्सपेक्टोरेशन, जो आप कफ निकाल रहे हैं, इज वेरी क्रिटिकल. अगर ये सफेद है मतलब आपको इन्फेक्शन नहीं है, एंटीबायोटिक की जरूरत नहीं है. लेकिन अगर इसका रंग बदलता है, पीला, नीला या कुछ और रंग आता है, तो इसका मतलब इन्फेक्शन हो रहा है. और उस समय अगर आपको बुखार ना भी हो, फिर भी डॉक्टर के साथ कंसल्ट करना बहुत जरूरी है. अर्नब, आगे बढ़िए.
Okay, so mainly the first I will go by for this asthma patients. So asthma, what happened in asthma? Asthma basically a disease for the children category of. Usually it's come at the younger ages. Though asthma can be happen in adult age too, but normally it comes in a younger age. So what happens in younger age? This kind of patients actually suffer from long-standing cough, dry cough mainly, no sputum production during the cough, wheezing, that is a whistling sound from the chest, and breathing discomfort. So this is actually comes in young patients. And the problem with us that many of doctors do the pulmonary function test and advise to take inhaler for these patients. And as this asthma is actually episodic. So what is episodic? It means sometimes you will have breathing problem. Again, after 2-3 weeks or 2 months, you may have this breathing problem. But between this period, you will be absolutely normal and symptom free. So what happened with the most people with asthma? They usually take inhaler during this exacerbation time when he or she will have this breathing problem. During this middle point where he or she has no symptoms, this kind of time, they actually forget to take the inhaler. Or they don't actually take this inhaler because I don't have any symptoms, so why I can take this inhaler. So though this is a major problem with these asthmatic patients, but you have to know that asthma is never silent between this point of time. Okay, it usually increases during this time. Okay, and you have to take a maintenance inhaler. Not for all, there are certain criteria which doctor will explain in patient to patient basis. So you have to take this inhaler during the middle point of time to maintain, to give raise to your airways, that this exacerbation rate, the exacerbation actually rate becomes less. Okay, so what happen in cold weather? In cold weather, the asthma symptoms actually increases. So most of the asthma patients during this cold weather and during this rainy seasons actually exacerbates. Okay, so what will happen this time? So there will be increased cough, may dry or with maybe with sputum production, increased wheezing, the wheezing sound, increased breathing problem, and you will feel a tightness in your chest. Okay, so these are the problems you will face during this winter season for asthma patients. Okay, and also in rainy seasons. Abhishek, next slide, please. Okay, so how you will manage this asthma during this winter season? So you have to limit your outdoor exercise during this winter season. You have to work out at home or in the gym. Why? Because in winter season, sir, just I already told you that there will be cold and dry air outside in the environment. Okay, so cold air and dry air will act as a trigger for asthma exacerbation. So you have to limit your outdoor exercise during winter season. When you will go outside, you should wear a scarf and use it around your neck, so that you will inhale some warm air during your breathing, so that your asthma don't exacerbate. Okay, you have to use humidifiers in your room. Keep them free of mold. Mold means if you use long-term humidifier, okay, it will affected by some fungal infections. Okay, so you have to clean it regularly. Okay, and you have to take care that the infection don't happen during your winter season. You have to regularly sanitize your hand, okay, during this winter season, so that and don't use your hand over your nose and mouth every time. Okay, so this will act as trigger in winter season for asthma. Okay, next slide, please, Abhishek. Okay, so yeah, see, you have to wash your hands frequently with soap for 20 seconds. What we are doing in this COVID season also, because hand washing and using mask is the main thing what we have to do in this COVID season to prevent infections. Okay, or use sanitizer while out can keep your winter illness at bay. Be conscious of your hands. Keep them away from your face and eyes to avoid spreading germ. And when you are in a locality, avoid sneezing or coughing in front of everyone. Use your hands to cover your face, or use a handkerchief to cover your face. Okay, so that the infection does not spread. Okay. Next slide, please. Okay, so next, what is the asthma action plan? So every patient with asthma, when you visit your doctor, okay, he or she will give you a asthma action plan. What is asthma action plan? So there are two kinds of medications during asthma. So one is the reliever medication, one is the maintenance medication. What is reliever medication? So when you have acute exacerbation, you have acute symptoms like increase in breathing problem, chest tightness. So there are some medications which will act immediately on your lung and will resolve the symptom. These are called your reliever medication. What is maintenance medication? Maintenance medication is a form of inhalers, some form of inhalers, which actually keep your airways calm so that exacerbation does not happen. So you should have a written asthma action plan which will be provided through your doctor, that during this exacerbation, what will you do? Okay, so what medication you have to take at what dosage? Okay, so doctor will explain to you. Okay, and there is another thing which is called the peak flow meter. Peak flow meter is available in our pharmacy and everywhere in the Kolkata. Okay, peak flow meter is kind of thing that you have to blow through your peak flow meter, and there is a color coded thing. Okay, green color, yellow color, and red color. Green color means your airways is good. Okay, yellow color means there is a chance of exacerbation, so you have to modify your medications. And red color zone means you definitely have some exacerbation in near future, so you have to immediately visit your clinician. Okay, so peak flow meter is also advised by us. Okay, and this is very important for your asthma patients. Limit time with your pets. If you are allergic to pet dander, keep your bedroom pet free. Abhishek, next slide, please. Okay. So if dust mites and mold triggers your symptom, keep your home cool and dry to inhibit their growth. Because in warm and moisture weather, okay, they actually grow more. Okay. Next, clean and replace filters in your heating and cooling air ducts. This is very important. And make sure your filters are clean at the start of every season. Check periodically to keep your indoor air quality is optimal. What we have heard the thing, the air quality index, it's everywhere now, it's very important, like kind of thing, air quality index. So what is air quality index? So air quality index is a sum up of 5 things. Okay, so it's a ozone, it's some particulate matter, sulfur dioxide, nitrogen dioxide, and carbon monoxide. So it's basically a complex equation which will give you some value regarding this air quality index. So the low the air quality index means the environment is cleaner. More the air quality index means the environment is actually harmful. So air quality is in the, I'll go deep into that later with my slides. Okay, so next slide, please. Okay, so you can see from this graph actually. Okay, so the effect of cold temperature on increased exacerbation of COPD patients. COPD, what is COPD? COPD is chronic obstructive pulmonary disease. It's actually a disease of
I think Dr. Bera got cut off with poor
Okay,
internet connection.
I'll continue. So this study on your right side demonstrates that effect of cold temperature on COPD increase rate. Those patients who have a chronic obstructive pulmonary disease where their lungs cannot breathe out easily. Those patients, Arnab is back. Arnab, are you back? You are on mute, Arnab.
Yeah, yes. Okay.
Go ahead.
Some network issues. Okay, yeah. So what you can see from this graph, okay, when the mean temperature is down, okay, the exacerbation rate are increased. Okay, so even in COPD patient, the exacerbation rate actually increases during this cold temperature. And COPD is kind of a permanent thing. So it's kind of a permanent damage to your lung. So you'll have symptoms throughout the year, but during this winter and rainy season, your symptom will increase. Okay.
Dr. Arnab, can you explain COPD?
Yeah, yes, sir. COPD is kind of a disease where there will be a permanent obstruction in your airways. Permanent obstruction. This is irreversible. Okay. In asthma, this is reversible, but in COPD, this is irreversible damage to you.
So why does COPD happens? Why does COPD happens? It looks like Dr. Arnab Bera
got cut off.
Net is very, very unstable. So what he's saying that as the temperature drops, the worsening of chronic obstructive lung disease becomes more and more. So
Your
those
lung.
who Arnab, are you back? You are on silent.
Ah, sir. Yes, sir.
Huh.
Okay. So next slide, please, Abhishek. Okay. So how will you manage your COPD in winter? First thing is don't smoke. Okay, smokers, you have to quit your smoking. Cigarette smoke is actually extremely irritating to your airways, containing more than 4,000 toxic chemicals. But when you combine your smoking with exposure to your cold air, your symptom of breathlessness will definitely get increased. Okay. So first thing, you have to stop your smoking. See, smoking, cessation of smoking is not easy. Okay, because there is some kind of mental problems you have. Yeah, I don't want to quit smoking. It's difficult for me. I am having constipation during if I stop smoking. Many blah 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 kind of thing. Okay, but there, even with this new era, there are some psychiatric drugs which are coming in, which can help you to cessation of your smoking. Some kind of nicotine gums. Okay, they are also available in over the counter, but you should consult your doctor. There are certain smoking cessation program actually which runs for over
So,
like
Dr. Arnab, you are saying that smoking is the main cause of COPD.
yeah, yes sir. Okay, definitely. So you have to quit smoking. Definitely in Kolkata, considering the air quality index, that is also harmful. That can also lead to COPD. But with combining this with your smoking habit, definitely that will increase. So you have to quit smoking. There are different programs like 6 weeks, 12 weeks programs. Or say there's certain assigned doctor who can help you in counseling, will give you medications to help you quitting smoking. Okay. Next, exercise window. That is same for your asthma and COPD patient. So COPD patients are too strongly encouraged to exercise, but not in cold weather, because cold weather will make them uncomfortable, even impossible. Try exercising indoor too. Okay, even if your indoor air is cold, that will also make them difficult to exercise indoor, because COPD is not a reversible problem. It's a permanent damage to your lung. So in cold weather, patients will definitely have problem exercising indoor too. But you have to do it in a graded way. How you are comfortable with the exercise. If you are having more breathing problem during your exercises, then you have to limit your exercise level actually. Okay, next slide please. So wear protective gear and breathe through your nose. So in COPD, this is very important. Okay, if you breathe through your mouth, okay, so the air you are inhaling with in your mouth, actually that is not getting heated. When you inhale your air through your nose, actually that is heated inside the nasal mucosa. So the air actually gets warmer when that reaches your lower airways. But when you breathe through your mouth, the air does not get it heated in the nasal mucosa. So that time your exacerbation rate is increased. So COPD patients are strongly recommended to breathe through your nose and may exhale through your mouth. Okay. So because your cold air is very drying and irritating to the airways, it can increase your breathlessness. So wearing a protective gear like scarf over your nose and mouth on a cold or a cold weather mask could be helpful during this winter season. Next slide, please, Abhishek. Okay. In the background of COVID-19 pandemic, what I am telling you, you have to stop smoking. Okay. So COVID-19 symptoms can be much worse in smokers. Smoking causes airway diseases, which are at risk factor for more severe symptoms in a course of COVID-19. Even quitting for 24 hours, your lung will work better than your last cigarette. Okay. And smoking actually damages your lung and makes it harder to clear out these harmful substances like virus, bacteria. This means that is harder for smokers to fight off infections. The COPD patients, actually what happened with this smoking habit, that mucus layer, which is protective mucus layer, that is also get damaged. Okay. So if the protective mucus layer got damaged, the virus and bacteria will invade your body more rapidly than in a normal patient. Okay. Next slide, please, Abhishek. So in a background of COVID-19 pandemic, you have to avoid air pollution too. Okay. So air pollution, which can cause a myriad of heart and lung disease, stroke, diabetes, all of which are the risk factors for severe symptoms in COVID-19. See, COVID-19, some patients will have mild symptoms like simple cough and cold, and some patient will have severe breathing discomfort, may require high flow oxygen, BiPAP, ventilator, many kind of things. So the patients who actually aged patients with multiple comorbidities like diabetes, heart problem, okay, even with the smoking habit, the symptoms will be more, and the patient will require more and more support to fight their infection. And sometimes they also could not make it. Okay. So long-term exposure to poor air quality can make our lungs more vulnerable to infections. So when you are exercising outside, it's very important that walking, jogging, or cycling, try to choose routes with lower air pollution. This means smaller and less busy roads or a park. Okay, so don't go through in the highway where many cars, lorries are going with a many high level of smokes there. Okay, so exercise in a better place. Okay, like a park. Okay. Next, we are all responsible for this improving our air we breathe. Simple actions: using our car less, okay, using energy dependent devices, switching off sockets that are not being used, and using fireplaces and wood stoves less can help the air pollution to be reduced. See why this air quality index gets downer during this winter season. The problem is the use of biomass fuel, okay, the use of fireplaces, wood stoves during this winter season. So that will emit lots of this sulfur, nitrogen, and kind of thing. Okay, that will actually do the air quality index will go down during the winter season. Okay, and we will have more symptoms. Next slide, Abhishek. Okay, so in the background of COVID-19 pandemic, keep up to date with your routine vaccinations. That will reduce your risks of catching viruses and help reduce pressure on a healthcare system during this pandemic. Here, this is my actually last slide. Okay, I'll just add some points here. So, what is your routine vaccinations? See, the children will have some vaccination schedule. We are all aware of. Every parents are aware of that vaccination schedule. But what we are not aware of this adult vaccination schedule. Okay, so COVID-19 vaccination you have to take as per the government protocol. Okay, but there are another 2-3 vaccines. First is influenza vaccine. Influenza vaccine you have to take every year during September, October, August, just before the winter season. Okay, so that during winter season the flu symptoms actually get down. It will not 100% prevent your infection, but it will reduce the severity, it will reduce the frequency. Next is pneumonia. There are two types of pneumonia vaccine. One is pneumonia conjugate vaccine, and one is pneumonia polysaccharide vaccine. So this is also have some rules. Okay, the pneumonia conjugate vaccine usually given over 50 years of age. Pneumonia polysaccharide vaccine is given 65 years of age or below with a problem like chronic lung problem, heart problem, kind of thing. So you will visit your chest physician or pulmonologist. Okay, he will give you a adult vaccination schedule. Okay, that is also very important to keep you safe and healthy during this winter season. Okay, Abhishek, last slide. Thank you, everybody. Be safe in this winter season and just follow what I am said in this presentation. Sir, up to you.
Thank you. Thank you. Thank you, Arnab. So, friends, Dr. Arnab Bera has brought it out very lucidly that what are the winter diseases for your lungs. He mentioned two things, asthma and COPD. So asthma, he said that it's cyclical, it comes and goes, but never stop your inhaler. He said that when you are not suffering, he mentioned three things, that you may get cough, you may feel wheezing. Wheezing means a sound coming from the lungs. You can feel your sound traveling through your lung to your mouth. And third, that you are breathless. These three things will happen, can happen. So when you are suffering from it, doctor has prescribed you certain medicines. Take it at that time. and when you are not suffering, continue taking low dose of it so you don't suffer. This disease never goes away fully. It just stays subliminal below the background, but disease stays there. So आप अपना ख्याल रखिए, दवाई बराबर लेते रहिए. एक बात इन्होंने और बड़ी साफ साफ कही कि जाड़े में आप एक्सरसाइज जो करते हैं, अगर आप एस्मा के पेशेंट हैं तो घर के अंदर करिए या जिम में करिए जहां गर्म हवा हो, बाहर मत करिए, क्योंकि जितना आप बाहर जाएंगे उतनी जो है आपको तकलीफ होगी और आपकी बीमारी बढ़ सकती है. दूसरी बात उन्होंने कही कि आप जो है हमेशा जो है जाड़े में अपनी नाक और कान ढक के रखिए अगर आपको एस्थमा या सीओपीडी के प्रॉब्लम है, क्योंकि नाक ढकने से आपका जो कपड़ा है वो हवा को गर्म कर देता है, इससे अंदर गर्म हवा आती है और आपको तकलीफ कम होती है. उन्होंने ये भी कहा कि सांस मुंह से मत लीजिए, नाक से लीजिए. नाक में हवा गर्म हो जाती है नेचुरली, मुंह से लेने पे हवा गर्म नहीं हो पाती, उसको समय नहीं मिलता है. तो ही has brought out very good point that breathe from the nose, not from the mouth. और जिन लोगों को क्रॉनिक ऑब्स्ट्रक्टिव पल्मोनरी डिजीज है, इसको हम कहते हैं सीओपीडी या ऑब्स्ट्रक्टिव डिजीज, इसका एक ही सबसे बड़ा कारण है स्मोकिंग, स्मोक एंड पोल्यूशन. इसको रोकिए, स्मोकिंग छोड़ दीजिए, क्योंकि जाड़े में ये बढ़ेगा ही बढ़ेगा. आपने लोग कहते हैं ना कि बड़ी पुरानी कहावत है कि जो सिगरेट पीता है वो कभी बुढ़ा नहीं होता, उसके घर में कभी चोर नहीं आता. पूछिए क्यों? उस घर में चोर नहीं आता क्योंकि रात भर वो खांसता रहता है, और बुढ़ा इसलिए नहीं होता कि जवानी मर जाता है. तो बचिए, सिगरेट मत पीजिए. सिगरेट से बड़ा कोई दुश्मन नहीं है. आप पैसा खरीद के पॉइजन ले रहे हैं, गलत बात है. अपने को रोकिए, क्योंकि जब आप सिगरेट पीते हैं तो आपका खुद का नुकसान नहीं होता है, घर का नुकसान होता है, पूरे घर भर का नुकसान होता है. हर आदमी को सिगरेट के स्मोक से तकलीफ होती है. स्मोकिंग छोड़ दीजिए. अगर आप कर रहे हैं तो बंद कर दीजिए. जिस दिन से आप बंद करेंगे उस दिन से आपको फायदा होगा. सबसे बड़ी ये बात यह है कि शरीर को रिकवरी की बड़ी अच्छी शक्ति है. We have enormous power for the healing. If you stop smoking, the effect will be visible from today itself. इन्होंने फिर कहा कि जो है अपना ही नहीं दुनिया का और देश का ख्याल करिए, आप गाड़ी कम चलाइए. एक बात इन्होंने और बड़ी जिम्मेदारी की कही कि जिनको एस्थमा या सीओपीडी है, अगर उनके घर में जानवर हैं तो उन जानवरों से के साथ कम समय बिताइए. उन जानवरों के साथ जरूर बताइए, भाई आपको मोहब्बत है जानवरों से, हम तो नहीं कह सकते कि आप उनके साथ मत रहिए. Please spend time with them, but as least as possible. One more thing is said, that biggest problem of asthma happens or COPD happens because of small mites. ये छोटे छोटे जू के तरह होते हैं जो आपके कपड़ों में रहते हैं, खास तौर से कंबल पे. जब भी कंबल बाहर नया निकालिए, उसको धूप दिखा के धो के इस्तेमाल करिए, उसको फ्रीक्वेंटली वॉश करिए. दो चीजें हैं, कंबल और आपकी तकिया और उसका कवर, ये दो आपको मैक्सिमम एनर्जी देता है. उनको साफ रखिए, उनको बच के रखने की कोशिश करिए. अगर आप इन सब चीजों का पालन करेंगे तो स्वस्थ रहेंगे. हम चाहते हैं मेडिका में आप सब स्वस्थ रहें, आप सब सुख रहें, आप सब खुश से रहें. और आप हमें कोई भी प्रश्न हो, हमें प्लीज 7439600616 पे व्हाट्सएप करिए. And last answer to you before we conclude, that it's a good practice to have a clean air at home. Air cleaners at home are a very useful adjuvant, especially those who have elderly population or children at home. घर में अपने एयर क्लीनर रखिए, लेकिन ध्यान रखिए उसमें फंगस न जम जाए, वरना जिससे आपको फायदा होना चाहिए था उससे आपको नुकसान होने लगेगा. क्योंकि जहां भी ह्यूमिडिटी होती है वहां फंगस आ जाता है. तो घर में कहीं फंगस मत होने दीजिए. अगर आपके बाथरूम में दीवार पे कहीं फंगस, उसको साफ करिए, रगड़ के रखिए. अगर फंगस कम रहेगा आपको तकलीफ कम होगी, आप सुख से रहेंगे. हम चाहेंगे आप सब सुख से रहें, और हम आपके पास हर हफ्ते हर शनिवार को 5:30 से 6:30 के बीच में आते रहेंगे. हमारे ब्रॉडकास्ट की इंतजारी करिए, हमसे जुड़िए और स्वस्थ रहिए. नमस्कार, धन्यवाद. May your weekend be good and nice. Thank you.